Hey, Wellness fam. Welcome to Wellness Wednesday with Dr. Latoya NP. As you know, we've been talking about several topics this month. The first week, we talked about breast cancer awareness, and we held space for those who have lost their battle with breast cancer, those who are in the midst of it, and those who are warriors and survivors. Second week, we talked about mental health and minding our mind and wellness and things of that nature and our peace. And one thing I want to talk about, and there was a good call out from a colleague and a friend of mine. She mentioned suicide. That's not something that we want to brush over. It's so important that we talk about that and that people feel comfortable and that they know that they have a safe space and that there is hope. There's a disturbing trend that's going on social media, primarily TikTok, where individuals are selecting dates that they're going to essentially harm themselves. I'm not sure if they're actually going through with it, but it just broke my heart to see that and to hear that people feel that they don't have anywhere to turn and that that's the last resort, and it's not. There's so much more that can be done to help individuals. And so just my heart goes out to those individuals. But tonight, we're going to be talking about something that impacts everyone, whether you're 25 or you're 75 years old. Your balance and your mobility are so important, which is why I drive home the message of how often should we be working out? What type of workout should we be doing? And how long should you be doing it? If you've been here any amount of time at Wellness Wednesday, you know what the answer is. I'm going to challenge you to drop it in the chat. You might be surprised to know, and you guys know I love my statistics. Falls are the number one cause of injury for both young and older adults. Every 11 seconds, someone in the United States is treated in the emergency room for a fall related injury. And over 3 million working age adults are injured each year from slips, trips, and loss of balance. And so the good news is that most of these falls are preventable with awareness, movement, that's right, movement, and a few small lifestyle changes things that you can do to kind of help that. And it's so important. When I say the things that we do today can help us in our future, it is really important. Falls just don't happen to older people. And typically, when we think about falls, we think about an older person falling and breaking their hip. They happen to busy parents carrying groceries. They happen to individuals who are working, who are, maybe up and down on ladders. They happen to healthy, active athletes who may be pivoting too fast and professionals who are sitting too long at their desk. It happened to me. I was getting ready to take my cat to the vet. He wasn't feeling well, and I needed to get him and take him to the vet. And I was rushing upstairs to go and get him. Went to go and grab the carrier to put him in, and before you know it, somehow I stepped. I don't know what happened, but I missed 4 steps and I fractured my foot. So if it can happen to me, it can happen to anyone. And I think I'm pretty healthy, but it happened to me. So here's what the statistics say: 1 in 4 adults will experience a fall this year. So if you're sitting in a room with 8 people, 2 individuals will experience a fall. I've seen individuals out walking their dogs and have fallen. I've seen individuals just in general places and have fallen because things are on the ground, they didn't see it, and we're so engrossed in our phones. We're walking, looking at the phones, and we're really not paying attention. So we have to be more mindful. 6% of workplace injuries involve slipping, tripping, and losing balance. And then 85% of head injuries in adults are related to falls. So how many times do we hear on the news someone was out skiing or doing something, they fell, hit their head, didn't go to the emergency room, and it didn't end well for them. And beyond injury, falls can impact your confidence. Once it happens, people often move less because they're afraid. And which actually increases the risk for falling again, which is why we have to stay so active and make sure that we are flexible, that we're mobile. And balance isn't just the older person issue, it's a full body, everybody health issue. And so we have to make sure that we're staying mobile, that we're exercising, and we're moving our body. So, what are some of the physical factors that can cause an individual to fall or put them at risk for falling? One is weak core. So when you're doing your exercise, and again, I'm not gonna say it, because you already know this. But after you've done your prescribed amount of workout each day, make sure you're including core and leg strength to that. So if you're sitting for long periods of time, which I tend to sit a lot because I work from home. And so I set my alarm to have me to get up every so often. And then poor posture. So technique, we're looking at our phones, we're slouching, we're slumped over. So we don't have the proper alignment of our body, which is putting us at a higher risk. And then tight hips, joint stiffness, arthritis, things of that nature, changes in vision, which alter our depth perception. You think that curb is down the road, but it's actually right there. Dehydration, low blood sugar, and skip meals can cause these dizziness and dehydration if you're not drinking your water. I want to talk about the skip meals because I do a lot of um, consult with individuals who want to lose weight, and we talk about all of the things that they can do to help themselves lose weight. And you guys hear my dog in the background. But dehydration can cause you to be dizzy. Skipping meals can cause your blood sugar to drop. And so, which can lead to low blood sugar. And those things can put you at risk for dizziness and falls. Side effects of medication, especially blood pressure medication or sleep medication. So we have to be mindful that if you have an individual, you are someone that's taking blood pressure medicine, that you're monitoring your blood pressure, that you're staying hydrated, that you're doing all of the things. And if you're someone that suffers from insomnia and you have to take medication for insomnia to help you sleep, be mindful of the time that you take it. And if you're getting up at night to go to the restroom, make sure that you have a well-lit path to get to the restroom and get back, and that there's nothing on the floor that can cause you to trip and fall. So what are some lifestyle factors and things that we need to make some changes in, right? Not enough movement during the day. Make time to move your body. Get up in the morning a little earlier and work out. High stress and fatigue. Wearing unsupportive shoes, the slides, the heels, worn out sneakers. Now, let me tell you a little story. I'm 6'1", and I love to wear heels. And I found these cute, oh, they were so cute, these cute heels. I promise you they were 8 inches high. I'm exaggerating, probably. I'm exaggerating. But they were nice, but they were really high. And I felt so unstable, but I wore them anyway. I did not fall because I had my husband with me, but they weren't supportive. They were cute, but they weren't supportive. And I know many of us love to wear our heels, but let's just be careful. I'm a Florida girl. If it my choice, I would go everywhere barefoot, because we used to run outside barefoot, no shoes, none of that. So I'm a flip flop girl. So slides and flip flops can actually put you at risk falling. And there's certain pair of slides that I've had that I've tripped over the slide. So I just stopped wearing them. And then ignoring your flexibility and stretching is so important. So if you're working out, make sure you're also stretching. Balance isn't just physical, it's mental and it's emotional as well. When your body's under pressure, your coordination and your reflexes slow down. I can tell you, that definitely happens to me. When I'm stressed and I'm rushing, I don't take time to make those movements the way that I should, and I put myself at risk of falling. And now I'm known to be clumsy. I drop stuff, I trip over stuff, and I've fallen just because I'm clumsy. And I just equate it to my big feet. And when I was younger, I was always falling because I felt like I was growing into my feet. Things that we can do in our home, keeping the walkways clear and clutter free, making sure that if we have throw rugs and mats in the bathroom and in the kitchen, that they have the anti-slip or non-slip grips under the bottom. And then make sure that our hallways are lit up at night so that, if you're getting up to go to the restroom or going downstairs, that you have light. And then avoid the loose rugs and cords that may catch your foot. When we were building a house, we were just excited to be building a house. So there are a few things that if we could go back and do, we would do them differently. Like for instance, we would have, for instance, we would have put a couple outlets in the floor so that we have a recliner, and it's powered by electricity. So we have a cord that we have to stretch across the floor to, plug it in so that we can elevate and recline the recliner. But if we had thought about it, we would have, had the outlet built in the floor, but we didn't think about it. So wearing supportive shoes with traction, avoiding rushing or multitasking while walking, which I'm guilty of, staying hydrated and eat regularly to prevent lightheadedness, and then stretch your body after long periods of sitting. I have a vibration plate, and so for me, when I'm sitting for a long period of time, I'll set, and like I said, I set my alarm so that I'm getting up. But usually, 9 times out of 10, when I'm getting up, I'm getting on my vibration plate, or I'm doing some type of stretching to kind of help make sure that I'm staying flexible and mobile. So your mindset also matters. So move with intention. And they say, there's this new phrase that health is your wealth. Health is the new wealth. Use handrails and assistive devices if you need. I have a friend, she's so funny. She did something to her ankle and she was traveling and she just fought having to get in the wheelchair. It was there to help her. So if you have devices that are available to you that you need and can help you, use them. They help you. Safety is strength. Listen to your body signals. Your body's going to tell you what's going on. And so just pay attention to that. Be in tune with your body. So if you're dizzy, pause and don't push through it. I'm guilty of that. There are times where I'm not feeling well, and when I wasn't feeling well, I would push myself to get through it. So just, take your time and do what you need. So are there any changes that we're talking about this that you might need to make in your home to help in these areas? Movement is medicine and health is wealth. So what are some of the exercises that you can do to help you? Heel to toe walking, and I'll put some short clips and videos on the page so that you are aware of what these look like. Chair squat or regular squatting, standing leg raises, one leg balance hold, marching in place, and then making sure that you're stretching for flexibility. So stretching for flexibility looks different for each person, but I'll provide some examples of those as well. What are some things that we can do in terms of screening? When you go to your annual physical exam or your, primary care provider, there are certain things that they should be doing and encouraging you to do, actually. Making sure that you're getting your hearing and your vision checked. And usually when I'm doing my physical exam, those are things that I'm doing on every patient. It's crucial for balance. If you can't see well, you're going to be off balance. If you can't hear, your equilibrium is off. And so with your annual exam, making sure that you're getting your blood pressure checked, that you're staying hydrated, you're checking hydration, they're looking at medications and making sure that if there's anything that could potentially cause you to be dizzy or impact your coordination, that they're having those discussions and conversations with you. And then for women who are over the age of 65 and men who are over the age of 70 or earlier, if at risk because of medication, because of disease process, or what have you, getting your bone density test done and getting those scans done. And then a fall risk assessment, especially if you felt dizzy, unsteady, or have had a recent trip or fall. Prevention isn't just about avoiding injury, it's about protecting your independence, your confidence, and quality of life. Many times, individuals who fall, especially older individuals, lose their independence because of that fall. And many falls can be detrimental for older individuals. And I've seen younger individuals who've fallen and hit their head and have had traumatic brain injuries. And so it's important that we are doing what we can to make sure that we are preventing falls, that we are building our mobility and our strength and flexibility. This week, I want to encourage you to commit to 10 minutes a day of movement. Now, if you've been here at any time, how much exercise you should be getting. Look, I'm trying to be serious. You know that I've encouraged you to exercise, and there's a set amount of days and amount of time and what type of exercise. Okay, I'm going to switch. It is recommended that you work out or that you move your body, moderate intensity exercise, 150 minutes per week. So 5 days, 30 minutes a day of moderate intensity exercise. If you're not there, I'm going to encourage you to commit to 10 minutes of movement a day. Choose 3 exercises tonight, do a home safety check, and then share your progress with us, right? I want to make sure that you are staying healthy, that you're staying safe. And if you're ready to take control of your strength, you can definitely reach out to us if you know that you're having any of the issues that we've talked about, or that you've noticed that you've been falling and that your coordination is off. Remember, balance isn't about age. It's about awareness. It's about staying strong. It's about staying steady, and it's about staying grounded in good health. And our mission with Wealth Legacy Health and Wellness is to ensure that our patients, our family, and our friends have the knowledge, the information that they can that so that they can advocate for themselves and create a legacy of good health. So I want to make sure that we are doing everything that we can to prevent falls. And again, it's not just an older person thing. Falls can happen to anybody. It's happened to me. And my fall was within less than a year. And I blame it on Woody. But is there something I could have done differently? I'm sure there was. Hindsight 2020, when I look back at the situation, there's several things that I could have done differently to prevent that fall. And I'm so grateful it wasn't as bad as it could have been, because I literally missed a whole landing of steps and fell. I could have injured my knee. There's so many things that could have happened. But gratefully, it didn't. And I'm just grateful. I did have to wear a boot. I did have to go through, therapy and treatment for my foot, but I'm still here. And I've made some adjustments, and I've done the things that I needed to do to ensure that I don't fall again. This is Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner with Wells Legacy Health and Wellness. We are accepting insurances: Blue Cross Blue Shield, Cigna, Aetna, Humana, TRICARE, and several others. We are offering new services. We just launched our medical weight loss. And it's not just all about the GLP-1. It's not about that. It's about so much more. It's about partnering with you on your journey to good health. Thank you so much for joining. Until next time, stay safe and be well. This is Dr. Latoya Wells. I'll talk with you soon.